It's time for Wave 3 Listens Live on Kentuckiana's first live local TV talk show, all hosted by John Ramsey. This is Wave 3 Listens Live.
And welcome to the Feel Good Friday edition of Wave 3 Listens Live. All the Kentucky Derby Festival events are in full swing. We're the home of the Kentucky Derby. Excited about that. But today I'm excited about the show. There's a big ceremony that's going on this Sunday. And John Paul II Academy will be here to talk about that ceremony. If you're Catholic, you know about the canonization of Pope John Paul II and Pope John Paul the 23rd. We'll talk about that a little bit and what it means to the folks around town here. Also with me now is Dr. Anthony Sears. Dr. Sears is with the Disc and Wellness Institute. Dr. Sears and I have traveled a little bit together. Didn't we see each other on a plane? We did, didn't we? Yeah, we did. We did. And usually when I'm talking to Dr. Sears, we're talking about wellness in terms of back and disc pain. He has some revolutionary news for those who suffer from type 2 diabetes. It is called the Diabetes Reversal Program. That's right, Diabetes Reversal Program. It's really interesting. Doctor, you brought on a couple of guests. I'm going to introduce them shortly, but tell me what's the difference between the traditional treatment for diabetes and the reversal program that you offer at the Wellness Center.
Well, basically what we see in traditional type 2 diabetes care, everybody gets the same type of medication. You get metformin, glucophage, glipizide, and some form of insulin. We use customized tests to find out what's going on with you, the mechanics of the body, see what's causing your type 2 diabetes. Basically, two things cause it: inflammation and insulin resistance. We do customized testing to find out exactly what's causing that inflammation and insulin resistance and work backwards to reverse that process. We work with a nurse practitioner, we do medical treatment, and as far as natural medicine, called functional medicine.
So it seems to me, talking to you here, Dr. Sears, it's not more about treating the pain, it's more about let's try to reverse what happens. Let's get you better, correct?
Absolutely. I'm a doctor of why, I tell my patients. You know, I want to know why. What is causing your type 2 diabetes? You know, I love stats, I love numbers. And if you look at the stats of America's medicine right now, we're ranked number 53 in the world in mortality rate. That means we got 52 other countries living longer than Americans. That's not right, because we're one of the richest countries in the world. So I'm not against medication. We need medications. It's like a crutch for a lot of our patients, but we got to find out what is causing that mechanism to cause diabetes and work backwards to reverse that process. And we've had a high success rate doing that.
I like that, Dr. Sears. Proactive is what it's all about at the Disc and Wellness Institute. So we're going to put up their information here shortly, but I want to introduce you to a couple of very special guests. Bobby Tinker is with us. Mrs. Tinker, welcome to the show.
Thank you.
And also Mr. Harold McNeil. Mr. McNeil, welcome to the show. You guys have actually been through this program, so I want to talk to you a little bit about that. Bobby, tell me about, as someone who suffers from diabetes, type 2 diabetes, what was your life like prior to going to the Disc and Wellness Institute, and what's it like now?
Well, I had no energy, depressed. I just didn't feel good. Didn't feel like getting out of bed, didn't feel like cleaning my house, didn't feel like going to church either. I hurt a lot, you know, and I've been 3 weeks in, and I'm like, you know, this is a blessing.
Wow, I love hearing that. And you were telling me it was more than just the symptoms from diabetes. You were saying everything changed for you,
right.
correct?
I have a lot of other things that came along with the diabetes. I have fibromyalgia with a pain. I had none of that. I have something called a rare liver disease, which is primary biliary cirrhosis, which is the same thing, almost as fibromyalgia, with the pain, the fatigue. I have none of that. I have this energy that I just can't believe, and they say I'm going to feel even better. I can't wait. I've only been 3 weeks in.
I love that. So Dr. Sears, this is really revolutionary for you, because instead of treating your symptoms, you're saying, get me better.
Yes, yes.
Love that.
You know, the medication just made me want to, some of it, I mean, I had allergic reaction to it, had to go to the hospital, but I love what I'm doing now.
I love hearing that. I can tell that you're passionate about it.
I'm just excited about it, because I've got a long way to go, but I'm still excited about it.
I'm excited for you. All right, Harold McNeil. Mr. McNeil, tell me a little bit about what was life for Harold beforehand, and now what are you feeling? How do you feel?
Like she said, I've had a lot of energy. I've actually painted my whole house.
Oh.
Come on over. I got a job for you this weekend.
I've just a whole lot more energy. They've dropped my insulin to 10 units a day. Last year I was on 100 units.
Wow.
My blood pressure has dropped. Just a lot of things. It has helped me with energy, and it's helped me. But you gotta like Vegetables.
That's okay.
Yeah.
That's okay. But I like the sound of, instead of, hey, letting you slowly deteriorate, and let's treat the symptoms, let's treat the pain, let's do something totally different, let's get you better. So I love the sound of that. And if you went from 100 units of insulin, now you're at 10, shoot, that you got a 90% decrease in medication.
He's only on his 2 months and have a 6-month program.
Wow, so he's only in the second month.
Absolutely. Absolutely.
Okay. So in layman's terms, I know it's complex. So how does this accomplish? Is it a comprehensive look? He mentioned diet. What other things are involved, Dr. Sears?
Diet's 1/6 of it. Okay, what happens is when you look at insulin resistance, this is how I tell my patients. If you have blood sugar issues, if we eat good food, if we eat bad food, most of that food eventually turns to sugar. It depends how much. When that sugar goes in your blood, you have a pituitary gland in your brain. It's called, think about a thermostat. If your thermostat's set on 70 degrees and your air gets below that, what happens? It kicks back on.
Sure.
So your pituitary kicks on and sends a rush of insulin to take care of that blood sugar. What happens with diabetics is called insulin resistance. You have a doorway where your sugar gets out of the blood into a cell that doesn't open. In this case, I call it like putting gum or tar on a key lock. If you try to open that door, it won't open. So what happens is your sugar gets higher and higher and higher.
That makes
you get
sense.
more and more medications, and you get on insulin. That's when it starts going downhill for a lot of people. Our system is through customized testing to find out what's causing that gum on that lock, if you will. So what happens when you can open up that door, the sugar can get out of the blood into a cell. It's called a mitochondria. It's like an energy factory. That's when you get more energy. The weight starts coming off without exercise. You start feeling a whole lot better. Okay. If that happens, that's why a lot of women say, "Is that true? You can really lose weight without exercising?" Absolutely, because it's not being stored as fat. When you take medication like metformin, glucophage, glipizide, not against it. You need that at first to get everything levelized. It takes that sugar in your blood and stores it as fat, as cholesterol and triglycerides. That's why a lot of diabetics either have high cholesterol, high triglycerides, or both. Our goal is to find out what's causing them to open that door to let the sugar out of the blood into the cell. And it's different for everybody. It could be one thing, it could be 20 different things. We do stool testing. We look for bacteria, yeast, fungi, tapeworm, roundworm, trichinella, parasites. And believe it or not, a lot of people have those. Those cause inflammation. We do food sensitivities tests. We find out what you can and cannot eat based on that. When I hate the word diet, a lot of people say diet you cannot eat. We don't give you a diet. We give you a food plan on based on what your body can accept. So basically, through all these customized testing, we find out what the mechanisms are that's driving up your blood sugar and work backwards. That's how we have such good results with that.
And not only are you helping out the typical symptoms that diabetics suffer from, but the ancillary effects is too. You talked about weight gain, energy levels, things like that.
Absolutely.
It all kind of snowballs as a positive, correct?
Absolutely. And you got to look at this about diabetes. I tell my patients is the complications are very serious. Amputations, kidney disease, you got to go on kidney dialysis. Number one cause of blindness in America. So this is why it's such a big deal. And so many people have it. A lot of doctors almost act like it's normal. They don't take it serious, in my opinion. There's a lot of good doctors out there, but it's a very serious disease that can be reversed at a high rate. And you got to do the mechanisms. You can't treat every patient the same, because we're all different. And that's why it's different about the program.
Interesting. Dr. Anthony Sears, a couple of his patients are with us. We're going to throw the information up on the screen. Again, it's the Disc and Wellness Institute. There's 2 offices. There's one here in Louisville. You see the address, and also in Lexington as well. They can help folks in Lexington if you know someone who suffers from diabetes, who's east of us. But there's the information. Now, we're going to bring on another patient coming up in the next segment, Joyce Connor. She's going to tell you about her experience. This is revolutionary. It is called the Diabetes Reversal Program. I'm telling you, folks, it's a little bit different from what you're used to, but not only are you going to treat the symptoms, you're going to feel better. You're going to get better and move in the direction of really what you want is optimal health. All right, so Dr. Anthony Sears will be talking to us. We'll be right back on the Friday edition of Wave 3 Listens.